Yay! Everybody loves each other.
Everybody smile.
Hello.
Alright.
I can see.
Oh,
Did you get it? It's not recording, is it?
it is recording.
Okay.
But
Ready? Okay. Rachel Rodriguez doing my persuasive speech. The U.S. requires 1.2 million new RNs by 2018 to meet the nursing needs of the country, 500,000 to replace those leaving the practice, and an additional 700,000 new RNs to meet a growing demand for nursing services. Across the United States, nurses are needed in all areas of the healthcare industry, especially with our aging population. They are going to need more help and healthcare in years to come. And the beauty of nursing is that, for one, we can do all shifts. You have 8 hours, you have 12 hours, you can do day shift, night shifts, you can work in doctors' offices, you can work in your own place, you can travel, you can, as long as you can go, every place needs nurses, so you're always going to be hired in different areas, and you can, if you travel with nursing, then you actually get paid more. So you can go to California. Always is on union, and so every time it's close to Christmas, California actually calls for nurses, and they get paid about 40, 50, 60, sometimes $100 an hour because of their need for nurses because they're union. And so you can go pretty much anywhere you want. We have even nurses coming down to Burlington that come from the Denver area because we need traveling nurses. And they, of course, the gratitude is you take care of patients and you, help them with every aspect of their personal care, good and bad. But you, being an RN, you just have to do mostly medication and make sure, do body inspection, make sure that they are not getting breakdown anywhere on their body, and make sure that they get all their healthcare needs, nutrition and fluids, electrolytes, and you, of course, like I showed you the other day, you do vital signs, which are blood pressure, respiratory rate. You make sure nothing's wrong with them. They're not getting, what's it called? They're not getting fluid in their lungs that can lead to more problems, complications in their healthcare, process. And then you, of course, try and make them better. Diabetics, you give them insulin, so you do shots or you give them medication, and you, there is always, and you can go in every single type of different kind of nursing. You can do schools, you can do, like I said, doctor's offices, you can do hospitals, you can do long-term care units, you can do, there's, like I said, you can do self nursing, where you just go to people's houses and make sure they're okay and always do follow-ups. And the only pros and cons of nursing is, of course, you always have to do patient education. But the bad thing is, of course, if they don't listen to you, then their education does not go up. But as long as we do follow-ups, the biggest problem I ever see, especially with the United States, is that we do not do preventative care. We tell you to stay healthy, but we don't teach you how to stay healthy. We don't tell you all the good and bad points of eating a nutritious diet and taking your medication to the full entity of it, because most people will quit antibiotics before the regimen is actually done because they feel better. Well, you really have to actually take them to the full extent, because the virus can grow actually back into your body, and that's actually the reason most people get sick again and healthcare industry goes down actually when you have to have, you go back and, we release you from the hospital, and if you come back to the hospital with the same health care decline, then the hospital actually has to pay for it.
Oh, wow.
So then there is, no benefit. That's the reason nurses are taught so fully to do follow-up care. We have to, and education, because we have to tell you all the different things that can go wrong. And again, that when you talk to a patient, they only hear about 3% of what you're telling them, because it always goes to worst case scenario. Doctors always have to tell you worst case scenario. Well, most people are not gonna actually go into worst case scenario. It's not gonna be that way. But they have to tell you that, otherwise they can get sued, because if that actually does happen, then they get sued because they didn't tell you what could happen. You can die on the table, yes, you can die anywhere. You can die from anything. But, so that is worst case scenario. So we always have to follow up on, or we're supposed to follow up on education, so then you realize how bad you really can be or how good you really should do. So, and then, the schooling is depending on how far you want to go. Like me personally, right now I'm in an associate's for RN. So I'm only gonna, after I'm done with school, I'm only gonna actually technically have an associate's degree, which actually I have right now, but I'm going to go towards my bachelor's degree, because when you go up to Denver or places like that, then they actually have, it's called magnet hospitals, and they actually only hire you if you have a bachelor's degree. A bachelor's is not better than an associate's, because all the stuff we learn is pretty much in our associate's degree, but the bachelor's is more managerial type. But when they say magnet hospitals, they want you to prove that I got it, that you have accomplished your they think that your nursing is better than just an associate's. The beauty of nursing is that there will always be a job available for nursing or people in the medical field. The medical field will always be going or be growing. Although nursing is not the most prestigious job in the world, it is an honest, moral, and empathetic job that takes great value and ethical views. The reward of nursing outweighs the pay, because you feel like you are always helping mankind. I don't know much